The amygdala and the neurobiology of fear. It's an almond-shaped center located near the hippocampus. It integrates sensory and cognitive informations and then determines whether there will be a fear response. This is regulated via reciprocal connections that it shares with orbitofrontal and anterior cingulate cortex. And the motor responses are regulated in part by the connections between the amygdala and the periaqueductal gray area of the brainstem. The endocrine reactions are in part due to the connections between the amygdala and the hypothalamus, causing changes in the HPA axis and thus of cortisol levels. Chronic and persistent activation of this aspect of fear response can lead to increased medical comorbidity, including increased rates of coronary artery disease, type 2 diabetes, and stroke. Breathing can also change due to the connections between the amygdala and the parabrachial nucleus in the brainstem. An accelerated respiratory rate when having a fight or flight reaction is to enhance survival, but in excess, this can lead to unwanted symptoms of shortness of breath, exacerbation of asthma, and a false sense of being smothered. These occur especially during attacks of anxiety, such as panic attacks. The autonomic nervous system is attuned to fear and can increase pulse and blood pressure for fight and flight reactions. These responses are mediated by connections between the amygdala and the locus coeruleus, home of the noradrenergic cell bodies. Chronically triggered as part of an anxiety disorder, this can lead to increase in atherosclerosis, cardiac ischemia, hypertension, myocardial infarction, and even sudden death. Therefore, scared to death may not always be an exaggeration or a figure of speech. Anxiety can also be triggered internally from traumatic memories stored in the hippocampus and activated by its connection with the amygdala, especially in conditions such as PTSD. Thus, the processing of fear response is regulated by the numerous neuronal connections flowing into and out of amygdala. Each connection utilizes specific neurotransmitters. These neurotransmitters are GABA, serotonin, norepinephrine, voltage-sensitive calcium channels, and anxiolytics that act upon these neurotransmitters.